Like you said, my name is Angel. I'm managing director for M Pharma. And at M Pharma, we work with community pharmacies to ensure that they can serve their communities better. We do this by managing their supply chain, ensuring that they have the right kind of stock and at the right kind of prices. And on an exciting note, I will be transitioning to Healthy Learners in a few weeks to be their Vice President of Operations. I'm very excited about that.
Thanks, Angel. And my name is Lonnie Hackett. I'm president and co-founder of Healthy Learners. We're a nonprofit organization with a mission to keep kids healthy so they can learn effectively. And we do that through our model of school-based community health, where we partner with the Ministries of Health and Education to train teachers as a new cadre of community health workers and integrate schools into the healthcare system. And so, as Angel mentioned, we're extremely excited to be here today, and we thought we'd use this opportunity to reflect and share on some of the lessons we've learned over the past year and a half as we've led small, younger organizations through this COVID-19 crisis. And as everyone knows, COVID has had devastating impacts around the world and has really exacerbated health and education equities. There's been a myriad of additional barriers to accessing healthcare as a result of it. And pretty much overnight, literally billions of children were forced out of schools. And in high-income countries, there were a lot more opportunities for more effective distance learning, but in low middle-income countries, particularly in public education systems, that's been an extreme challenge and has resulted in significant losses of education and learning time, but also is associated with higher school dropout rates, gender-based violence, teenage pregnancies, and early marriage. And so while there are more challenges, the work that all of us are doing is also more important than ever. And while COVID has made work harder, it also has created opportunities to amplify impact. I know at Healthy Learners over the past 12 to 18 months, we've been able to support the national government on the development of 3 policies and guidelines and leading the reopening of schools, while also increasing our reach from 45 to 106 schools to serve nearly 250,000 children.
Yeah, amazing stuff. And on our end, I think while our focus has always been on pharmaceutical products and ensuring that these products were available across different communities, when COVID hit, I think one of the things we recognized was there was a significant gap in the diagnostic space. And so we were able to transition and kind of support local laboratories and also other local institutions to support their diagnostic work. And like Lonnie has said, I think what COVID did was provide this opportunity where there was a lot of players that came together in the health space. And what this provided was kind of this fresh ground for innovation and growth and expansion. And over the last few years, we've been talking about this as we were preparing for this kind of keynote speech. And a few things emerged that we thought would be really interesting to share with you. And I'll let Lonnie take over from this part.
Yeah, and the first kind of thematic area, or the first kind of component that we felt led to both of our organizations being able to respond to COVID was the fact that these are locally led organizations. That Healthy Learners, all of our staff are based in Zambia. All but 3 of our staff were born and raised here in Zambia as well. And I can't tell you how critical it was in the early days of COVID to be able to come together as a leadership team, as a broader organization, to be able to evaluate the situation, to put our heads together and make effective decisions. And also how critical it was to have that proximity to our work, to be able to reach out and meet with our partners, whether it was teachers, school administrators, health workers, to be able to better understand how the pandemic was impacting them and how our work could be adapted to be able to effectively respond to that. And we knew particularly early on that, as a younger organization, and having our locus of decision-making based here in Zambia enabled us to be a lot more nimble. It enabled us to quickly respond to strategic opportunities, to step up outside of our comfort zone to support our partners, and feel very confident that if it wasn't for that, we wouldn't have been able to have amplified the impact the way that we have.
Yeah, I completely agree. On our end, we had we had a very interesting challenge right when the first wave of COVID started to hit Zambia, and we had an opportunity to take over a few community pharmacies. And typically what we do is work towards integrating these pharmacies into our standard kind of operating procedures. But because of just some of like the instability that was caused as a result of COVID, we were pushed to kind of think about ensuring that the people at the store level were involved in our day-to-day process and decision-making. And what this resulted in is ensuring that is having these stores even be more successful than they typically would have been in the first phases of this takeover. And so for us, it just kind of like reinforced the idea that having the people that actually work on the ground with the communities or with the different teams on the ground being part of the process is extremely important. And having these people empowered to make decisions is also extremely important. And I think what this allows us to also think about kind of transitioning into our next theme is around being value and mission driven, right? And I think this was a very important and like very core part of how we thought around our operations during COVID. And so one of the things that happened, as we well know, was there was quite a disruption of the pharmaceutical market, the pharmaceutical space and supply chains, especially in the first 6 months of the pandemic kind of being announced. And what this did was it resulted in, when uncertainty happens, people worry about risk, there's concern. And when there's risk, people increase their prices. And so people who needed insulin, people who needed hypertension medication, people who were on cancer drugs were very concerned around that time, around what the price of their drugs and of their medications would be. And so we worked together with other manufacturers and distributors to ensure that we could offer consistent pricing for core chronic disease medications. So we launched Keep My Price, which was a product that allowed people to lock in the price of their chronic disease medications over a 6-month period of time. Because for us, our values are around an Africa in good health, and we cannot do that if people do not have access to medication.
Yeah, and I really couldn't agree more with Angel, the importance of having strong values and a strong culture and a mission-driven organization. In the early days, there was a lot of risk, and from the nonprofit sector, it was not knowing what was going to happen to the global economy. Were we going to see significant drops in our ability to raise resources to make sure that as an organization would be alive, not just now, but 5 years, 6 years, 7 years, to continue to have impact and move towards our mission. And so there were some difficult strategic questions of, do we expand a little bit to support our partners? Do we, take a more conservative approach, or do we really do everything we can to respond to this moment? And for us, kind of that epiphany aha moment was just asking ourselves, well, what are our values? And what decisions are consistent with those values? And we knew that our partners needed us now more than ever, and that we had the ability to step in and provide a really key support, whether that was helping schools continue to get information to their students while schools were closed, whether it was providing clinics with key supplies and health information and information education material in those early days, or supporting and leading schools to reopen and then accelerating our growth, more than doubling in size to make sure kids throughout the capital city were served by our model. And it was the recognition that our value is to put our beneficiaries, those that we serve first, and that to do that it meant really pushing ourselves to stretch and do what we could to support them. And I think falling back, having those clear values was why we were able to make really concise but important decisions during those times of uncertainty. And so kind of pivoting a little bit, and the next thematic area that we came in of why our organizations were able to respond to COVID. And for us, one of those key areas was leveraging non-traditional individuals in the healthcare system. And for us, the core of our work is training teachers as community health workers and connecting schools with that healthcare system. And having those teachers involved throughout the pandemic, from the early days, getting information to students before schools closed, continuing calling and reaching out to families after schools had closed, having teachers be that trusted group who parents and students knew they could trust the messages they were getting from them, particularly as there were a lot of rumors, misconceptions, and mistrust with the healthcare system globally in those early days, and that has unfortunately continued to persist. And having other key members of the community working side by side with that health sector was a great way for us to begin to counteract that. And after schools opened, the teachers played a critical role of making sure students still had access to healthcare. We know that COVID hasn't stopped all the other illnesses. Kids are still getting malaria, they're still getting diarrheal diseases, respiratory infections, and making sure that they still had access to primary health care. So all the gains that have been made prior to COVID are not lost. And saw these kind of non-traditional players as really key to helping to prevent COVID from further widening health inequities more broadly.
Yeah, I mean, that sounds like really amazing. And I think it provides like a really great transition into our next theme, which is around multi-sectoral collaboration. And when we think about this, and especially moving from like thinking about the core of non-traditional healthcare providers and moving into this space where we had so many players and there was so much, again, we'll say opportunity to collaborate across, especially for M-Pharma, for example, that is in the for-profit sector, to collaborate with the government, to collaborate with non-profit organizations, and to further support the communities that we have been serving throughout the last few years. And for us around collaboration, I think one of the most pivotal things, and I spoke about this earlier, was being able to transition from our core business, which was just pharmaceuticals, into the diagnostic space. In a time where testing was at an all-time low, I think across low and middle income countries, we recognized that there was a role for us to play. And I think it was kind of like just the nexus of different events that provided this opportunity for us to interact, even leading diagnostic manufacturers, and be able to provide PCR testing machinery, antigen testing machinery for our community laboratories that we work with, but also with research institutions that use these diagnostic tools to run DNA sequences of COVID and like provide information to the national, but also international decision-making bodies around, for example, what kind of COVID variants we had in the country. And this was like really proud moment and something very exciting for us. But I think one of the things that has been the most interesting for us has been our opportunity to collaborate with the Zambia National Public Health Institute. That will see us rolling out over 5,000 COVID antigen tests for free at our community pharmacies. And so what this does is kind of decentralizes COVID testing and COVID diagnostics and brings it down to the community level and ensures that these people in these communities, because it's free, and also because it's free and because it's in collaboration with the Public Health Institute, that people continue, that access to diagnostics is improved in these spaces.
Yeah, certainly the pandemic has shown the importance of public-private partnerships and how health intersects with every sector. And perhaps at Healthy Learners, we found how critical our relationships were with multiple ministries, having built over the past 5 years relationships with the Ministry of Health, but also the Ministry of Education. And that became really key when helping coordinate health interventions in schools, which required bringing those two ministries together. I remember very well on May 14th, the president of Zambia made an announcement that schools would reopen on June 1st. The very next day, we got a call from the Ministry of Education asking if we would help lead the development of guidelines for development and implementation of guidelines for reopening schools. And what was a rather surreal moment, over the next 10 days, we had senior members from both Ministries of Health and Education at our office, working from morning to night to develop those guidelines. And those relationships we had built was really key, but also being able to loop in members from the district, members from the community, to make sure these weren't just nice policies on a shelf, but that they were pragmatic, that they were something schools could effectively implement. And having those local voices there was also key. But the fact that there was that level of trust, that the relationships between these ministries have been established over years through the school health program, became really critical during this time of crisis, and was a large reason why we were able to get these guidelines developed, approved, and implemented within really a 2 to 3 week period.
Yeah, I mean, I think over the next, as you go through this convening and this gathering, which I mean, we're really excited to have been a part of, I think what the lessons we've learned from this has been that COVID was difficult, but it also provided that there's been an opportunity to identify some of the bright spots and some of the silver linings. And I think through the thread of some of the stories we've been able to tell you is then like this coming together of organizations from different sectors that were all willing to kind of work together to improve the situation. And there's definitely more to be done, but there's also has been this opportunity where organization had this opportunity to interact with national level with the ministries of health and the ministries of education. And I think just kind of the preparedness to meet that opportunity with the ability to kind of provide it in front of us, I think is as a result of...
Just, in closing, I think it's important to also remember that the last year and a half has been really hard.
Yeah.
Personally, professionally, emotionally, for pretty much everyone across the globe. And it's important to acknowledge that. And I think for our team, what was really critical was remembering our mission, and really focusing on what are the ways that we can continue to support those that we're here to serve: the schools, the teachers, the administrators, the health workers, the students. And that's made, each day gave us purpose. When we woke up and we went to the office or worked remotely from home, and really helped keep us driven. And so just to kind of close, whether you're a leader in your organization or at any level, to remember that these are really difficult times, but there are also opportunities to further amplify and expand your impact in ways that you probably couldn't have imagined a year or 2 years ago.
Yeah.
And so to keep that as also fuel, that now's an opportunity for 10 years from now to see progress in issues around health equity or education equity, so that we live in a world that's better prepared for future crises, and that we're able to use this spotlight on the issues that are impacting, whether it's kids or adults, to make really meaningful progress. And that's only going to happen from organizations, particularly locally led organizations, who are able to step up and support their communities.
100%. Thank you so much once again. We're so excited to have been a part of this. And quite honestly, this whole process also gave us an opportunity to look back and think about some of the great experiences and tough experiences of the last year. I think we have a couple of minutes, so if it's possible, if there are any questions, we'd be happy to answer them. But over to you. Thank you so much once again for the opportunity.
Thank you.